And as we approach Halloween on Tuesday night, Gloucester County officials are issuing a warning to parents: beware of marijuana-infused candy. Really, guys? Health officials there say there's now a significant presence of marijuana edibles in New Jersey and nearby states. They warn parents to beware of unusual candy packaging and to call police if they suspect any wrongdoing. All right, with Halloween comes a stockpile of candy that can lead to health issues if you're not careful when selecting your sweets. So some types can do more damage than others. To help you decide what you should or shouldn't eat from the trick-or-treat bag, Dr. David Monokian is here. Good morning, sir.
Good morning, Bill. How are you?
Great. We're about to rain on people's parade.
A little bit.
Let's start over here with kind of the candy.
Sure.
All right, so obviously bad for you or not so much?
Well, again, if it's taken every now and then, it's not as bad, but you know, everything in moderation is okay. But yeah, there are some healthier alternatives that we could choose.
Okay, and the obvious problem with all this is just a whole bunch of sugar.
Right. Exactly.
All right, so we get that part. Like, that's pretty obvious. Most parents know that. You move down and start looking at some of this other stuff.
Sure.
Explain to me, we got diet soda?
Right.
Okay.
Right. So soda, you know, one of the worst things for our teeth is definitely soda. I mean, so it doesn't matter whether it's regular, diet, clear soda, darker soda, root beer, whatever you want. It's, you know, it's really the acid in the soda that's the most damaging to the teeth. So if you're going to drink soda, again, moderation is key. You can use a straw. It helps to bypass some of the tooth surfaces. But it's really that acid. You want to be careful. It really just coats the tooth. And can start to really demineralize or break down that outer, harder covering of the tooth. Okay, so
in diet soda, it's not so much it's worse for you, it's just more damaging to you.
Right, it's just, it's just the acid in the sodas that's really the most damaging to the teeth.
Some of the other things I'm seeing out here are surprising to me.
Right, sure.
So walk me through some of these.
Sure, okay, so, you know, we have like citrus fruit, so you have things like grapefruit, oranges, lemons, and limes. You know, the thing with citrus fruits is while they provide many health benefits, it's the acidity again. So teeth break down at a pH of about 4, which is an acidic pH. You have things like grapefruits, which is a pH of about 3, lemons and limes, which is a pH of about 2. So, you know, the key here is if you're going to eat it, that's fine. Be careful not to brush your teeth following eating things like this, because you're actually brushing that acid into the teeth. So you want to wait about a half hour, 45 minutes, drink some water, milk, try to buffer some of that acid, and then go ahead and then brush.
See, that's unbelievable information, because I always thought you go ahead and do something like that, the first thing you're supposed to do is brush your teeth.
No.
You say, wait.
Definitely not.
Let's go.
Yeah, so some of these other things, you know, like the goldfish crackers and the pretzels, again, not sugar, but as they're broken down, they're chewed into this like gooier consistency. They get stuck into the grooves of the teeth very easily. Okay. As those carbohydrates break down, they break down into sugars. The bacteria then like to eat those sugars, and the byproduct of that bacteria is an acid. So again, it's the acid that's damaging our teeth. And there's evidence on the teeth that as dentists we can detect and talk to our patients about what we're seeing and maybe some alternatives.
So they know when we're lying to them. Thank you, doctor. We appreciate it. I'm gonna take this. We'll do this.
Go for it.
And I'll brush my teeth after
wash
I
it down
eat
with
these.
a little soda.
There you go.